In this tutorial today, we're going to cover a general overview of PowerChart Maternity. We're going to cover the check-in or check-out process, the tracking shell toolbar, or we also call them icons, as well as the column structure of the tracking shell. Upon signing in using your username and password, you'll be directed to the tracking shell. Upon signing in, you may be prompted to a check-in provider task. Within this screen, it is going to have you change your name if it's not populated automatically. I am signed in as the OBRN, therefore it is automatically populated for me. I'll hit OK here. It's going to take me back to the tracking shell, and you can see the tabs across the top of the tracking shell. These will allow you to have different views of the other units within the birthplace. The labor and delivery unit will have specific labor and delivery beds, as well as the mother and the baby unit. The mom-baby unit will have use of only babies. The nursery will be on 3rd floor. Lactation is for the nurses, and that's for the nurses that do lactation. Recently discharged will help cover those patients that have been discharged and lactation will need to follow up on. The provider tab is actually for the nurses and or the physicians. After we've checked in as a provider, it will allow you to change. If you're assigned a different phone number for that day, then you can put that information in here. It will also direct you to that provider check-in tab. You may also put in a comment in this tab. So maybe if you need to go to lunch or you need to be leaving early for the day. Anesthesia will also have a tab here that they can use to do their post-epidural assessments. It will allow us to see that they've been assessed by the anesthesiologist so that the patient may be discharged. We'll go back to the All Beds tab. It is a quick picture of all the beds that patients have assigned to them in the unit. Now we will move down to the toolbar. As I said earlier, a lot of times these may be called icons. But these tools, on this bar, the icons are actually interactive when you click on them. They have a specific link that they will take you to. The first one, the ambulance, will take you to the pre-arrival form. It will allow you to put information in on the patients that are coming or that are going to be admitted or orders from the doctor's office. The admission history will populate on your to-do list when a patient is admitted. When you click on the red cross, it will take you to the power form for the admission history. The clipboard with the pin is to quickly add an order on whatever specific patient you have highlighted within the tracking shell. This is the pregnancy summary. This folder will take you into the patient's chart. So for example, you're opening their chart, you can document or redo results. There's also a time clock that will allow you to modify your events that you have set in schedule for that patient. You can also set events that are to be completed, resumed, or started. There's an education and follow-up that you may click, and it will take you to charting on the education and follow-up appointments for patients. The house starts the departure process on the patient. It also has different links to charting options that you can document on that patient. As well as a provider checkout, it's a quick way for me to sign out or check out and assign my patients to other providers. I can also assign this patient to a specific provider since no one has been assigned. The paper form allows me to print reports such as an OB summary report, a birth log report, many options. As we move through the columns on the tracking shell, you'll notice that there's a bed assigned to the patient with the patient's name. The patients that are in yellow are pre-arrived patients that have not actually been emitted, but we are holding a spot for that person. This status tells us if that patient is a laboring patient, MAG patient, induction patient, postpartum patient, and that can be changed very quickly by clicking within the boxes in the column. The age will populate from star. There's information on allergies that can be documented. When you hover, it will tell you what specific allergies this person has and when it was documented. So then you can see the RN column has the RN initials that are providing care for that patient, as well as their phone number. We can change that on a day-to-day basis. The provider column is the MD, or the physician that is assigned to provide care for that patient. It will populate from star. The ped is the actual pediatrician that the patient has chosen. The DC potential column allows us to populate a yellow arrow to that patient, so that way we know that that patient desires to maybe go home, and we're waiting an order for the physician. The to-do tab are outstanding tasks or orders that the nurses need to do. For example, Rogram needs to be administered on this patient. The R stands for Rebella meeting needs to be administered. There's our house again, which means the depart process needs to be started because the discharge order has been written. The notifications allow us as providers to have a quick peek at the problems and diagnosis of the patient. And problems, diagnosis. And it will allow us to take better care of them in a more visual manner. Once you hover across them, it will tell you what each one of these stand for. There are many different types of notifications, so if you're not sure, just hover over the icon and it will give you a definition of what it stands for. There's also an order column that tells us when there's outstanding orders on a patient. The lab column tells us that there was a lab ordered, and actually hovering you can see that it was a CVC, and it has not been collected yet. So there's one outstanding and uncompleted. The MAR is the medication administration record. Here you can see that number 8 represents 8 outstanding medications that need to be completed. Within the comments, you can actually put a note. For example, this mother in preterm labor is going to be sent to Denver. If we move back up to Labor and Delivery tab, inside the tracking shell, you will notice a few different columns within this tab. You can see that there is a gravida para option, dilation, effacement station, if there's a rupture in membrane or not, and it will tell the color. This is populated from your documentation within the interactive view. The EGA actually populates from your delivery date and time within a patient's record, and it also tells us the estimated gestational age at delivery in just a quick way to review it, so that way we're not searching through documentation, as well as the same columns within the All Beds tab. As well as the epidural, we can change, and that's if the patient's had one or if they don't want one. If it's been administered, you can see that it's been discontinued here, or if it was been administered. You can see the pediatrician for the baby, and you can see once again what the comments might be. You can add comments as well.